three panelists who are joining us, who are in the field doing work directly with students on a daily basis. Students, young people, however you'd like to refer to them. And we also have Senator Samra Brouk, who is joining us. And Senator Samra Brouk is the co-sponsor of the Comprehensive Sexuality Education Bill. So we will start with our guest panelists who are out in the field working with youth on a daily basis. And then we will end with remarks from Senator Brouk, and then we'll give you an opportunity to ask questions. At that point, I'll also remind you when we get to that point, we'll just ask that you use the raise hand feature to ask your question. And the raise hand button can be found under reactions on the bottom of your screen. So that's where that is, so everyone knows. The other final piece of information for you is, if you're wondering what you can do to help support this effort, we will email all of you resources and guidance tomorrow morning, so you have the tools needed to make a difference and help get comprehensive sex education passed or uniform for New York State. So no need to try to jot down a million notes. We will reach out to you because we have your email addresses. So we are going to start with Danielle D'Onofrio, and Danielle is a certified health education specialist and outreach education specialist. She wears two hats. She works for both Restore, a program of Planned Parenthood, and also works for Planned Parenthood in general as an educator. So Danielle, welcome. And I'm going to allow Danielle to tell us a bit about why comprehensive sex education is so important to the work that she does.
Yeah, absolutely. Thank you so much, Deborah, and thank you all for having me and coming today. It really means a lot for you all to show up and show support for this bill. So I have a little graphic just to kind of talk to you a little bit more about Restore in general. It is one of our programs of Planned Parenthood. So let me just find my fun little graphic for us all real quick for you. So Restore is the sexual assault service in our community. We have a 24/7 hotline. We do short-term counseling. If a person goes to the hospital for an examination, we are there to help them through the medical, legal, and even students through our student conduct process. That includes our K-12 through the Title IX student conduct process. And part of what I do is our educational workshops. So I am in a lot of K-12s, especially right now. We're doing a lot of work. I've actually been in a lot of kindergarten classes doing fun puppet shows for the kids. So it's a very rewarding, very needed job at all sorts of ages. So that's part of what I want to talk to you all about too. I really think that the comprehensive sex ed is not just needed for the sexual health aspect like HIV, STDs, and pregnancy prevention, but it's also needed for healthy relationships, intimate partner violence, consent. Things that I think sometimes are overlooked. I can tell you when I go into classes of kindergartners, it's very fun to tell them that they're the bosses of their bodies. They feel so empowered, and empowering young people is the best part of my job. Having those aha moments where kids realize that they're the boss of their body, and having to tell that same thing to 16, 17-year-olds, and that's the first time that they hear it. That's the first time that they find out that they can reverse consent, that they're allowed to say no. And that's the best part about this bill, is that we are starting at a young age. We're teaching body autonomy. We're teaching boundaries. This also teaches resilience in accepting no, in being okay with rejection. I know so many females in my life, particularly right now, who are afraid to reject, particularly male identifying folks, out of fear. And we are changing that with comprehensive sex ed. Because yes, from a standpoint of teaching the youth to put on condoms, to protect themselves from harmful diseases, but we're also teaching them how to have healthy relationships, how to have healthy sexual relationships, but also healthy relationships with their families, with their friends, how to set boundaries and how to respect that. And overall, we're building a better, healthier community, somewhere where we're going to see that intimate partner violence decreases, that domestic violence decreases, and sexual assault places where folks are feeling freely to go out no matter their gender identity or how they express that gender identity. So that's, I think, part of the thing that I love the most about this and why it's so important, because we're not just teaching the youth how to put on condoms and how to protect themselves against an STI. We're teaching them skills that they can take on through their lives, and we're starting young, and we're teaching them that this is normal rather than them questioning it or not understanding. We're teaching them healthy habits to begin with that they can take with them the rest of their lives. How do we communicate with each other? Are we doing it in a healthy way? And what are red flags? And how do I correct my behavior so that I don't fall into unhealthy patterns? I think that that's a really important thing that we can all use, because some of us had survival skills that are unhealthy, but we can teach these kids to have healthy survival skills and to grow in a way that empowers them and helps them become strong and empowered individuals. Thanks.
Thank you, Danielle, for that great overview. And again, I'll just remind people who are just hopping in, we will reserve questions for the end of the program. Now I'd like to introduce Dr. Mofiyin Obadina, Internal Medicine and Pediatrics, President of the Association of Minority Residents and Fellows at the University of Rochester Medical Center. And she will be able to tell us a bit about her experience in treating young patients.
Thank you so much for the opportunity to talk with you all today about sex ed. I'm a resident physician at U of R, just as I was introduced. So, you know, in my experience as a primary care provider for patients, many of them who happen to be adolescents and young adults, you know, it's fairly obvious to see how much they're not well prepared for the real world. And, you know, relating to what Danielle said, you know, a lot of them you can see aren't ready for healthy relationships, physical and emotional relationships. You know, I was having a conversation not too long ago with some of my co-residents, and somehow we got onto the topic of sex ed. And it was very remarkable to discover that for many of us, our curriculum essentially was, you know, having a baby doll or a stack of flour to care for at some point in grade school. You know, it's weird to think back now and see that somehow we were expected to learn about the nuances of sex and the consequences of sex by essentially just documenting the stressors of having a baby by, you know, saying when we fed them and when we changed the baby. You know, and now I don't think that all school districts are doing that, you know, at least not that I've heard of, but I think it is a fact that New York State is lacking in terms of how we standardize health education. There is just such a wide variation in the quality and the quantity of education. And I think that leaves our young adults at a disadvantage when they're, you know, ready to be out in the world and live adult lives. You know, to be frank, I've had to explain to my adolescent patients, even some older ones, even parents, that, you know, condoms cannot and should not be reused, that most contraception options cannot prevent sexually transmitted infections. You know, I've had to spell out and explain how you have to completely treat every incidence of infections that you get, you know, including treating your partners, because it prevents reinfections. You know, I've had to break the news of pregnancy to 14-year-old women who cannot comprehend the possibility that they could be pregnant after a single sexual encounter. You know, I've had to sort of gently express concern for abusive behavior when I hear it from my young patients as well. Sometimes even before they can see it, sometimes before they can, you know, finally acknowledge it. And, you know, to support them when they decide that they've had enough and they're ready to leave those abusive relationships. And, you know, none of all these experiences is just unique to me. I think there's so many of my co-residents who will give you similar stories. And the idea here is that it's just such a widespread lack of ignorance and show of ignorance when it comes to adolescence, when it comes to things, you know, just some basic things too about sex ed. And I think for all these instances, it's very clear for as we hear the stories to to see how each person is individually affected from the health standpoints, right? So infections and down the line, infertility, unplanned pregnancies, and as Danielle talked about, violence in terms of the physical and emotional abuse that can happen in some of these relationships. But I think it's also not so hard to see how it affects the other aspects of their lives. Downstream consequences for kids. We think about like lower graduation rates that's been documented, lower academic achievements, and that sort of like snowballs into lower income and wealth levels for those patients, and also negative impacts on their emotional health. Data shows that a lot of these consequences will impact already marginalized communities, so Black and Brown folks, LGBTQ populations as well. I think that if one of the goals behind having public school education is to, provide our kids with all the resources and opportunities that they need to be productive and social members of society, I think it's imperative that sex ed and sexuality education is a given as part of that, just because, as we just mentioned, these consequences sort of like leach into multiple parts of our society. We know what works. We know that using evidence-based, medically accurate, and comprehensive curriculums work for teaching kids about reproductive and sexual health. We know that reinforcing continually the education, the material works. We know that, I think that speaks really to like making sure that the material is age appropriate, right? And it's for the right developmental stage of the kids, right? So for starting young, we're teaching them things that apply to their age and things like that. We know that providing access to contraceptive and preventative health services works. And, we have national health sexuality education standards that already provide a foundation, so we don't have to do anything from scratch here. And, data shows that when kids get comprehensive education, they make safer choices. They have healthier outcomes. They learn important life skills from reliable sources, which is a big thing to note because a lot of kids will come in and say, I heard something from someone else, and they want to clarify it, and almost always is something that's wrong. But making sure that we can give them reliable data and source that they can trust. I think that's what we all want for our kids. So in conclusion, I think this Senate bill has the ability to kind of standardize and provide those critical aspects of good sex education, and it will impact our patients individually, but also our communities for the better. And I think that really our adolescents, they need us to make it happen for them, for their well-being. But yeah, thank you so much. I really appreciate the opportunity.
Thank you, Dr. Obadina. We appreciate your insight as a medical professional. So thanks for joining us. And our next panelist is Absara Haile, and she is Supervisor of Health, Education, and Outreach with Planned Parenthood of Central and Western New York. Absara, welcome.
Thank you, Deborah. Good evening, everyone. Thank you for spending some time with us this evening. I oversee a teen agency known as In Control, and it's a program of Planned Parenthood. And our primary focus at In Control is to empower our youth to make educated choices about sex and personal health while striving to meet the educational, physical, and mental needs of our youth, their families, and the collective community in a safe and inclusive and also supportive atmosphere. So before I jump right into comprehensive sex ed, I do want to share with you guys a little bit about In Control and the work that me and my team do here. So we achieve our goals through a number of outreach and educational programs and activities in an effort to cultivate the minds of our youth. So one of the ways that we did that this past year was we facilitated a COVID academic support program while the schools were strictly virtual. So we provided that necessary support that a lot of our youth need and our teens needed. And it also helped foster an environment where we could build relationships and provide information and also provide them that necessary health education that they often need. We also challenge our youth to express their creativity through dance, music, and video production, fashion design, and our culinary arts programming. We also encourage them to use their voice and allow it to be heard through Rochester's only teen-run radio show and program, where our teens get a chance to write and create and produce public service announcements while running a radio show, and all of their messaging relates to the teens' physical, emotional, mental, and sexual health. In Control also hosts an Afro youth group where students are able to connect and share their experiences growing up as first-generation Americans, especially in the African community. We noticed that there is a significant divide. I can attest to it myself, being first-generation American born and not having a space where you can openly talk to your parents about things just from that cultural difference. So we help foster that environment and provide necessary education as well. And then from the parent perspective, we also hold parent educational groups to help improve the parent-child communication and foster an environment of positivity and active engagement. And while we place emphasis on all of the wonderful programming that we do, our goal always connects back to the significance of comprehensive sexual health education. We deliver 2 evidence-based programs to our youth in both the school setting as well as community settings. And these programs equip the teens with necessary tools and resources to make informed and educated decisions about their sexual and reproductive health. The fact that there's information available at our fingertips with our phones, our tablets, laptops, and all these other devices makes it easy to get information, but not all that information populated on a Google search is medically accurate. And that's the challenge that we often see as health educators. Our youth are exposed to inaccurate information from other teens, social media content creators, and other rooms that they enter on a daily basis. And I personally believe that this is why sexual health education is imperative. And I can attest to it over the 8 years that I've been an educator. Introducing concepts of human development early in a child's life helps set the foundation for their physical, emotional, social, and intellectual growth. For them to be able to understand the human body from an anatomy and physiology aspect helps to reduce the shame and stigma many people, young people face when they ask questions about their health and the changes that they experience physically. So by normalizing that, they are able to gain the necessary tools and information that they need in order to make informed decisions. Also, by emphasizing the dynamics and aspects of healthy relationships are also imperative in maximizing the developmental success of our youth and their families, the youth with their families, their friends, romantic partners, etc. The youth are also able to learn to develop their own personal skills, such as identifying what their own personal values are, which help in their decision-making abilities, and that they are then able to utilize negotiation refusal skills, as well as where to go for help when seeking resources. Once our youth have that solid foundation on the concepts of human development, healthy relationships, and personal skills, when concepts of or curriculum of sexual behavior and sexual health are introduced, the conversations are far more comfortable, informative, and what I find to be most interesting is how engaged our young people really are in the discussions. The curiosity is there, the misinformation will always be there, but having a space where teens can ask questions freely and honestly and openly without fear of judgment makes a significant difference in the health outcomes of our youth. So providing them that medically accurate, culturally and age appropriate and developmentally appropriate information that's being delivered in a trusted environment is key. And again, the unique thing about In Control is that we have the opportunity to focus on the direct needs of each teen that walks through our doors and help connect them with the resources that they need. So this task is not always easy, but as a youth program, we're here to serve our community by way of our teens, which is why I continue to advocate and support this bill in ways that I can. I was having a conversation with one of our peer educators, our youth peer educators yesterday. And she said that given the state of the world today, and just being a teen is hard. I'm sure we can all remember the challenges that we faced as a teenager. She said, I'm sure it's different than when you were a teen, Miss Absara. And, I asked her in what ways, and she just kept talking about it, just giving me little tidbits from her experience. And she said, I just wish more people had places to go, like In Control, whether it's adults or young people, where they can walk in and say, hey, I have a question. Somebody at school said this, it doesn't sound right, but can you clarify whether or not this is accurate? And I answered it for her, and she's like, oh, okay, all right. And she took a piece of candy out of my office and she went about her day, right? But not a lot of our teens have that. And I think by opening it up and introducing this into the schools a bit more from the curriculum aspect, the knowledge and the education and the quality of self-development that our youth will have will be amazing. And I think right now we're just in a unique position where we can all come together, united with a common purpose, to further improve the state of our educational system by providing our youth with the tools and resources to not only reduce teen pregnancy and unplanned pregnancy rates, but also to make the best overall informed decisions about their health. So I would like to say thank you again for your time and for listening to me this evening. And I hope I got to share with you a glimpse of In Control and how important educating our children on making safe and informed health decisions truly is. Danielle and Dr. Obadina, thank you for all your hard work in the field. And then also thank you to Senator Brouk for sponsoring the bill and seeing the need for comprehensive sexual health education here in New York State. Thanks again, everybody.
Thank you so much, Absara. And again, thank you to Absara, Mofi, and Danielle, because you can speak to this better than I can. I don't work with students every day, so I appreciate having your insight since this is the work that you do day in and day out. So thanks for joining us and for sharing your stories. So we're going to switch gears and we're going to welcome Senator Samra Brouk, who is the co-sponsor of the Comprehensive Sex Education Bill, to tell us a bit about the bill and why it's important to her. But I'm just going to make one more reminder, housekeeping notes for those of you who joined us later. We just ask that you reserve your questions until the end of the program. And if you're wondering how you can support this effort, we will email you resources and guidance tomorrow morning. We have all of your email addresses since you all registered for the event. So have no fear, you don't have to jot down a bunch of notes. Check your inbox tomorrow. So now I'd like to introduce Senator Samra Brouk. Senator Brouk represents New York's 55th district, and that includes portions of Monroe, Ontario counties, including Rush, Mendon, Pittsford, Parenton, Fairport, Penfield, East Rochester, East Arundecoit, Naples, Bloomfield, Victor, and the east side of the city of Rochester. She also serves as the chair of the Mental Health Committee and member of the following committees: Aging, Alcoholism and Substance Abuse, Education, Elections, Health, and Women's Issues. And again, I will remind you that she is the co-sponsor of the Comprehensive Sex Education Bill, that is Bill S for Senate 2584. Senator Samra Brouk was raised in the city of Rochester and surrounding suburbs, and she earned her bachelor's degree in psychology at Williams College. And she's always worked to help provide quality services, greater opportunities, and vital support to those in need. And her dedication to public service led her to join the Peace Corps, work with local governments to improve recycling efforts, improve services for seniors aging in their homes, and address inequities and inequalities in public school systems. So as a leader in nonprofit community development, she has spent a decade building educational, environmental, and senior services initiatives in her own community and communities across New York State. So Senator Samra Brouk, thank you and welcome.
Thank you so much, Deborah. And thank you all to the community leaders and organizers and healthcare providers and youth development specialists who have talked to us today. And for hosting this event. I think they've really laid out the reasons for why this type of education is so important. And I'm happy to be your legislative partner in this work to make sure that we can move it forward. And I want to go back a minute because I think it's interesting to share, you know, when I was first approached to carry this piece of legislation, I'll be honest, I asked a lot of questions to better understand the need for something like a comprehensive sex education curriculum. And I will tell you all, it didn't take very long for me to realize this is far more than what many of us have traditionally thought of as sex ed. And I use the quotes because it's very colloquial. We think of certain things when we think of those words. And as Deborah said, I am a graduate of our local schools, and certainly I think what we have described here, the key word is comprehensive. This is very different than what we may have called sex ed about 20 years ago when I was at Pittsburgh Menon High School. And I am grateful that you all have taken the time to really describe the need for it and what it entails. I also think it's important that we understand here in New York State, we are one of only 22 states that do not currently have statewide comprehensive sex education requirement. What that means is that our students currently have a patchwork of education when it comes to understanding their own bodies, healthy relationships and boundaries, and also how to respect others' boundaries and identities. So just to put that in context, that means that if you go to school and one side of my 55th Senate district, and I got to give a shout out because the one I think we didn't hear was West Irondequoit. I also have them in that district. There's a lot of towns and villages. But what it means right now is that a student going to school, say on the east side of Monroe County or the southern part of Monroe County, is right now potentially getting an entirely different education in terms of boundary setting, understanding their own bodies and their own sexuality than another student on the other side of Monroe County. That's why this piece of legislation is so critical, because it creates a consistency across the state and better equips young people with the knowledge and skills to make responsible decisions. And these are the decisions that are affecting their health, their well-being, and to be better able to distinguish between healthy and unhealthy relationships, which is something that I think today, looking at headlines, we're hearing a lot about, and that's why having this language is so crucial. But I also want to share a story, because I find that oftentimes sharing stories, just as Absara shared a story about one of her young students, it kind of illuminates the issue a little better than talking about the technicalities of each grade level and what they're going to learn. And this is one that I didn't even mean to be talking about this work in this context. But the thing is, when you do work like this, you start to see reasons everywhere for why this is so important. So this was this past weekend. I was talking to a mother. She has two sons. One is 7, one is 9. Sorry, one is 6 years old, one is 9. And the 6-year-old had just come home from meeting a new girl that had moved next door to their home. This was here in New York State, and she was a year older than him. And they had played most of the day, and he came home at the end of the day to his mom and seemed kind of bothered. So she talked to him. And he told her, and this is in true, 6, 7-year-old language, that girl hit my bottom and I didn't like it. And that's what he told his mom. And she immediately said, well, did you tell her that you didn't like it? Did you tell her that's inappropriate as the language that, she had taught him? And it occurred to me to think, this young girl, we don't know if she's having a similar conversation with her parents. We don't know if she's had any conversation around, we keep our hands to ourselves unless we ask for consent. And this young boy is lucky, obviously, to have a mother who spent the time to explain to him, you don't have to do that. If you're uncomfortable, you can say it, you can come home, you can talk to me about it. But my heart kind of ached for this young girl, because if no one had that conversation, again, in a cognitively sound way that would make sense for a young girl of that age, who knows what kind of behavior that turns into as an adult, simply because of a lack of education. This is what we're talking about when we talk about K through 3rd grade. We're talking about simple things like owning your body. I love that someone said, be the boss of your own body, learning what's okay and what's not okay, and really feeling comfortable in practicing that language. These are truly the types of things we have to make sure our young people understand. Again, I think about not just statewide, but I think about our local headlines that have been completely heart-wrenching, of sexual harassment, sexual assault, bullying. And people right now are really searching for solutions. Well, we're here to tell many of you this is a major part of the solution. This is how we educate our future generations to be empathetic, to live safer lives, and to be more considerate adults and potentially future leaders. This comprehensive sex education bill specifically will allow the Commissioner of Health and Education, and in key to point out, in collaboration with a number of experts, and I'm going to list them out so we're all under the same page, or on the same page, teachers certified in health, biology, early childhood education, certified and licensed social workers, school nurses, school administrators, school board members, parents, and parent-teacher associations. This is the group that will be collaborating to create a model curriculum for K through 12 that is suitable by age, again, based on cognitive, emotional, and behavioral capacity. Because truly at the end of the day, I think all of us as adults, as leaders, as voting members of our communities, as many of you are, it's our job to set up our future generations for success. And part of that success means having a better understanding of their own physical, emotional, and social being, because that's what leads to better adjusted adults who make safer and healthier choices. So for all of those reasons, and for many of the reasons that have been outlined today, it's been my honor and my pleasure that I was chosen to carry this forward and to make sure that we are creating, again, a more empathetic society and leaders who understand and can speak to their own boundaries and respect those of others. And I truly think this is a huge piece of the puzzle if we really want to stop seeing the types of headlines that are incredibly troubling that we've seen lately. So thank you so much to Planned Parenthood for hosting this. And I'm happy to take any questions along with the rest of the panel.
Thank you so much, Senator Brouk. We appreciate your support and your leadership in carrying this through. And you can count on us to continue doing the good work to advocate for the comprehensive sex education bill. So thank you, Senator Brouk, and thanks again to our other guest speakers, Absara Haile, Danielle D'Onofrio, and Dr. Mofiyin Obadina. And right now, I'd like to give you, our guests, an opportunity to ask any questions that you may have. And just again, if you have a question, use the raise hand button located at the bottom of your screen. It's under reactions, and we will unmute you and give you an opportunity to ask your question. So let's see, we have one hand raised, two hands raised. I think Alfonsine was first. So let's see if we can unmute him. Okay, Alfonsine, you're unmuted.
Hi, good afternoon, good evening. Thank you for offering this Zoom tonight. I'm just curious if you could be more specific with what evidence-based research you are referring to specifically. When you refer to evidence-based, I've heard the term thrown around a lot, but I haven't heard details on it.
Okay, would anyone like to take on that question? Any of our panelists?
I can speak a little bit to just the medical piece of things. You know, in general, when we talk about evidence-based, it sort of depends on essentially what part of the education you're talking about. So the first part of it is that there are other counties, other cities, other towns that have tried something similar. So a comprehensive education or curriculum, tried it out, and they've sort of assessed before and after if there's any change in kids or in students choices, safer choices. They've assessed things about how they understand before the teaching, after the teaching. So there's some evidence in that sense. There's some evidence to support that when we do comprehensive health care versus comprehensive sex ed teaching, longitudinal teaching. So from when they're in the grade school all the way up to 11th, 12th grade. They have done some studies in other places that show that they have better outcomes, they make better choices. And then from the more medical point of view, so giving them just the facts, right? So for instance, letting them know that IUDs are 99% effective versus condoms alone, or giving them just facts. This is the rate of infection rates for so-and-so. This is the rate of what, just giving information, and that's using evidence to support some of the teaching.
Thank you, Dr. Obadina. I don't know if anyone else would like to add to that. Okay, thank you. And we have a question from Jim. Jim, you're unmuted.
Hi, good evening. Can everybody hear me?
Yes.
Okay, thank you. So first, I'd like to thank everybody for their time. I really appreciate it. As a parent, I'm a little concerned because, maybe it's just my viewpoint, but it sounds almost like you're encouraging or maybe normalizing promiscuous or more maybe earlier activity than our family agrees with. And I didn't really hear anything mentioned about talking to kids or instituting morality or principles, or do you go over the long-term negative psychological and detrimental effects of abortions? And, to me, this should really be left up to the families. And maybe if the families aren't providing the education, maybe we should be helping educate families so they can educate their children in the way that they deem appropriate.
Okay, thanks, Jim. Would anyone like to address that question? Any of our panelists here, or Senator Brouk?
Sure, yes, I unmuted. I think that in terms of the more medically sound understanding, I'll definitely leave it to an actual health practitioner. But what I do think is important, and I fully understand where this parent is coming from as well. I think part of this is really, a lot of this is much more simplistic understanding and education around, again, when we're talking about boundary setting. So in fact, a lot of, at least the statistics that I have seen, a lot of this education actually leads to things like fewer pregnancies, leads to safer practices. So when we talked, at the beginning, the doctor was talking about some of this evidence-based information that we've been sharing. We see that teens who have received comprehensive sexuality education were 50% less likely to report a pregnancy, right, than those who received no education around it, or to just abstinence-only education. So I think that is a lot of where this is based from. Again, I want to be clear, as a legislator, I believe in the ability for this education to occur with some sort of consistency and uniformity, of course, being in collaboration with parents and folks on the ground locally as well, and would obviously leave it to those experts that we listed, like people trained either medically or in these education fields, doctors, parents, teachers, to be able to actually build this curriculum. But I do think it's important that what we have seen are statistics that show safer behaviors come from having this kind of consistent education.
Thank you. And I'd like to add as well that if you've seen the curriculum, and I don't know how many people in the audience are familiar with it, one of the things covered in the kindergarten through second grade or kindergarten through third grade level is talking about family structures, the diversity of family structures. So that is something that comes into play. And later down the road, as many of our panelists said, everything is age appropriate and it's developmentally appropriate given the student's grade level. We talk about things such as birth control, contraceptive options, as well as adoption, and abortion is also discussed. So there's a variety of items discussed. And I know that, I think Jim said earlier, is there talk about morality? Morality is a tricky issue to take on, because again, if we're talking about the diversity of families, my level of morality might not be identical to what my neighbor defines. You know, we all have different, I guess, spectrums or scopes. So that's something that I think might be a bit tricky. And if we stick to science and medicine, that's an easier piece to weave into the curriculum. Let's see. But I'm going to give, because Betty Garcia's hand is raised and she has not asked a question. And we can come back to the other two who already asked a question earlier. So Betty, I'm going to unmute you and you may ask your question.
Am I unmuted? Yes.
Yes.
Okay. So I am not so much asking a question as making a comment. I am responding to the participant named Jim as a parent. So I don't want the school to teach morality to my children. And I did work to do some comprehensive sexual education at home. And I taught my daughters how their bodies worked and how ovulation worked through the Billings method of natural family planning. And what that taught them was to own their bodies and to make decisions for themselves. And they were not sexually active as children. They waited till adulthood, and I didn't give them an age limit. I told them, you know, again, my morality, but the idea of the importance of our schools are around sharing the science and the medical information. And then we as parents, our job is to weave in the morality, and our children can make decisions to best meet their needs. And so, sorry, it wasn't a question, but I had to share my own personal experience as a mother of really giving my daughters strong information about how their bodies worked and watching them make decisions that were very different than I did because I didn't have good information. So thank you.
Thank you for sharing that, Betty. Jen has her hand raised and has not yet asked a question. So Jen, you are unmuted.
Hi.
Jen? Oh,
Hi, thank you.
Yep.
I also am wondering where some morality discussion would be held or fit into this bill. I just from listening to the conversation, it seems that, you know, we're only touching the tip of the iceberg with all that's involved in this program. I'd like to see, I think if you were to provide parents with a list of curriculum that you're planning on using throughout the state. I don't see why the state would need to mandate resources like this to include all families that may not agree with certain things that are brought into the classroom at certain ages, et cetera. And quite frankly, Samra, I would ask that as a constituent, that you take your name off as a co-sponsor until there's more discussion around this.
Jen, may I just respond to one part of your question? There
Absolutely.
is a clause in this bill that allows the parent or guardian to opt out. So if a parent or guardian feels strongly that they do not want their child partaking in this learning, that is an option for a parent or guardian to select.
Sure. Oh, that's great. That's great to hear. It's also, it just seems like a giant step forward to mandate this rather than to look at resources and programs that we could have in the classroom without having them passed into legislation.
Well, thank you for sharing your
Thank you.
comment.
Thank you for your time, guys.
You're welcome. I don't know if any of our panelists would like to respond to that, to Jen's statement or question statement.
I can respond a bit, especially if Jen is a constituent of the SD 55. I always love the chance to hear from folks in the community. So thank you for jumping in and for being so active, Jen. So yes, Deborah covered part of it. I also think that some of the other pieces of this are a lot of times going back to a lot of the data that for many, many years now has been collected. And I think that will be part of some of the follow-up information that I hope Planned Parenthood will share, or we can make sure that that gets shared. And I also want to, again, ground us in, again, what kind of education we're talking about. So in some ways, it's things that are likely taught here and there. We just want to make sure that there, again, is consistency. And the reason why is because we do believe that everyone in New York State, as they're growing up, should have the same opportunities. And, it's just like we just had this, this great win this year of finally fulfilling foundation aid, which is funding for our schools, because as New York State, we believe that everyone deserves this sound basic education, right? And so we don't want a student in one zip code having, much less opportunity than another student, because they might end up in college together, right? And they might be looking for the same opportunities. Similarly, with something like this kind of consistency. And again, I do want to make sure we understand that there is a piece of this bill that a local district may choose to take more ownership over what their specific curriculum looks like. And that came straight from talking to people just like you, Jen, and just like a lot of folks who wanted to have more of a say in what that curriculum looked like. So the state, again, along with this panel of experts and parents and teachers, doctors, with the Commissioner of Education and the Commissioner of Health, they will give a model curriculum backed in science, backed by age-appropriate, cognitively appropriate information for young folks that will be different for a 4-year-old than it will be for a 17-year-old. But if a local district would like to come up with their own, as long as it abides by certain requirements, that is something that can certainly happen. And that is something that will happen in partnership with PTAs, Board of Education, or Board of Trustees based on the makeup of your local district. And I also want to give maybe some examples that might be helpful for folks to understand. So when we're looking at grades K through 2, what are some of the things that we're talking about as a part of this comprehensive curriculum? One of the things is explaining why bullying and teasing are wrong and how to respond to it. Another one is explaining that all people have the right to not be touched and to identify trusted adults and demonstrate how to clearly say no, which I think we can all agree is something that, especially here locally, we have to make sure our young people understand. So when we're talking about some of our younger folks, that's really what we're talking about. It really is these kind of simple notions that they'll be learning around how to protect themselves and how to understand kind of their place, right? Physically, emotionally, socially, among some of their classmates.
Thank you. And we will include, as I said earlier, tomorrow we'll be sending you all some resources. One of the things we will share with you is the curriculum. So you can see for yourself what is covered for K-3, for a 4th grader, a 7th grader, a 9th grader, et cetera. So I think once people actually have that in front of them, it will feel a little more, I guess, accessible to understand. So we will share that with you so you can review that at your own leisure. So let's get back. We still have time for a few more questions. Savan Holt, I've unmuted you.
Hi. So mine isn't really a question, but to piggyback kind of off of what the parents were saying. I am, and Ms. Brouk, when she talked about just being, it being age appropriate and just knowing, when someone's touching you and things of that nature. We also had an incident with the Hilton principal, and as someone who was molested when they were younger, I think these are great things to have in place. And also considering that students in the city doesn't have that opportunity to have their parents talk to them, or are as blessed as some of the parents on here who have that one-on-one talk with their kids. So I think that is very important that these are in place for kids who don't have that opportunity, for someone to sit down with them and tell them certain things about these these things that you guys discuss, and also knowing that, sorry, I was walking up the stairs, but also knowing that at a certain age, the doctors ask us to step out of the room. So our kids are already given that privacy. So for the schools to already like to implement, hey, you know, if you're going to be doing these things, be safe with it, or these are things to watch out for, or, you know, just giving them a heads up and guiding them along the way. It's not necessarily meaning it's promoting it, but it's like, if it happens, here is a protective way, or here are things to think about during that, you know, during that process. And like I said, my son is 17, and I think it was at 14 or something, the doctor asked me to step out of the room. I didn't agree with it, but these are things that our kids won't discuss with us, that they'll discuss with a total stranger because they feel more comfortable of how it's going to be received, and they're not going to be judged.
Thank you. Thank you. And thank you for sharing such a personal story, Savan. Let's see. Okay, I'm going to go back because I know Alfonsine's hand has been up for a while.
Oh, Deborah, for a second, I just wanted to respond to our question or our statement really quick. And I appreciate you so much for sharing with us. I know that must have been a hard thing to share, and I am sorry that that happened to you. And that's part of the work that we do with our Restore program as well. And that's part of what makes this bill really great, because kids have the information at their fingertips. Like Absara was saying, the amount of TikToks that I have seen from kids just in this pandemic alone, that they were like, well, I saw this thing. They're going to seek out the information. The average age that a child's exposed to pornography is 9. All right. And those can be very violent. And that's where they're finding their normalcy of what sex is. And that's why it's so important for us to go in and say, hey, what you're seeing online isn't normal. What's normal is this evidence-based curriculum. It's showing respect, owning your body, respecting each other, and respecting our boundaries. So we're not showing kids anything more than they already know. We're talking about things that are age appropriate for them. And sometimes they might have questions for us that might be even above where they should be appropriate. And that's also warning signs. Those are things that we want to address. Because if I have a 6-year-old come to me and say something that's not age appropriate, that's something that I'm going to see as a warning sign, and talk to that kid more, and maybe find out that maybe they're not receiving safe touches, that maybe home isn't a safe place for them, or maybe school isn't a safe place for them, as we're seeing right now. So it's not just so much, hey, we're saying that sex is great. We're normalizing that we should have body autonomy. We're normalizing that there's different things that are happening, and that pornography isn't normal, but science and education is normal. And we'll have them learn that from young ages so that they can grow out and go into the community and be supportive, good, productive members of society who are making good choices.
Thank you, Danielle. Thanks for bringing that up and reiterating that. Appreciate that. And I see we're about 3 minutes before the end of the program. I'm going to let Alfonsine ask a question here. You're unmuted, Alfonsine.
Hi, Deborah. Thank you so much for allowing me to ask the last question of the evening. I feel honored. I found a 4-leaf clover today, so I feel honored. With all due respect to Danielle, I am actually a parent of a special needs child. And I've also taken courses such as Dark to Light, which does actually touch upon these things. So I come to you as someone, I don't know if I would say an equal, but I would like to say that, yes, these discussions need to happen. However, given the state of our education system after the whole COVID, pandemic, I think that this should be a pause, and we should be more concentrated on getting kids back into school and having their mental health addressed in that respect, because I can tell you that there's been suffering that I've seen. And while this is an important topic, I asked Samra to take her name off the bill at this point, and address getting kids back to school first, and then, discussing this at a later time until parents are able to look at the curriculum, look at your stats that you've discussed this evening that, I would love to see them, as well as, honestly, I really feel like, the mental health state of my children and other children that I know kind of trump, the whole sex ed, comprehensive sex ed discussion at this point.
Thank you, Alfonsine. I can step in just because you mentioned me, and I want to, and because you mentioned mental health, and obviously a huge component of my work, in addition to representing the needs and the needs of the 55th district, is also as the chair of the Mental Health Senate Committee, where I actually spent most of my day before joining all you lovely people for about 6 hours today on a hearing around the crisis of mental health in our state. We have actually passed a number of bills around just what Alfonsine is talking about, and that is making sure that we are dealing with the crisis of mental health as it is, and it is a crisis. Throughout COVID-19, we've seen increases in isolation, social isolation, anxiety, depression, kids ripped from their normal routines. In fact, we've seen a stagnant or decrease in reported suicide attempts, but actually it's gone up for young kids of color. And that's really, really troubling. And it's why we've been trying to tackle some of that in terms of, on the state side, at least, of trying to make sure that we are investing in making sure there are mental health supports in our schools, making sure parents have the supports and education they need, although it sounds like you are well equipped with that at this time. But those are all the things that we're looking for. And we're really trying to do it all, because the truth is, every day that we don't get these things right, it's our young people who are being affected, right? And just for any of my constituents listening, I take that incredibly seriously. It's the first thing I think about every morning, is what we are doing to better support our district as a whole, but especially our young people. There are young folks who 1/10 of their lives on this earth have been in COVID-19. That's going to affect their development. That's going to affect their brain development for the rest of their lives. Whereas some of us, it's 1 year out of many, many decades, right? We have, we've lived life in a pre-COVID-19 world. So I certainly agree with you. I think there are a lot of things that we need to do. And I also think that this has to be a part of the discussion, which is why I think panels like this are so important. It's why I'm so grateful to have partners on the ground here, many advocates and folks who have worked in these roles like Planned Parenthood, like so many of the panelists, to make sure that we're educating parents, as many parents have described, making sure they feel comfortable with the types of things we're talking about. And again, I will say, it is never a legislator. It will not be me saying this is the exact thing that we're going to teach a young person. It will in fact be people who are certified professionals, and will do it in collaboration with parents and the local districts. So I'm looking forward to being a continued partner in that with all of you. And I really appreciate you taking your time to share with us this evening, as I'm sure everyone has busy evenings. Thanks.
Sorry, I was on mute. Thank you, Senator Brouk, for that response. And I also wanted to share that we started down this road even earlier than the pandemic. In fact, we were scheduled to take a couple of bus loads of teenagers to Albany for Youth Lobby Day on March 17th. But unfortunately, because we had switched into pandemic mode, we could not take busloads of teens to the state capitol for Lobby Day, but those teens were prepared to speak to their elected officials and talk about the state of the curriculum or what they're being taught in schools. That did not happen, but this has been a journey in getting this legislation passed. So I just want people to know that this was something that had been in the works well before we were hit with the COVID-19 public health crisis. So I do want to respect people's time, and folks probably have to eat dinner. But I do appreciate all of our panelists joining us, and of course, Senator Samra Brouk for being here to explain in greater detail the Comprehensive Sex Education Bill. For everyone, again, who registered for the event, we have your email addresses. We are going to send you resources, including the one-pager or two-sider curriculum overview, which will show you in detail what will be covered for each grade level. So that might help answer questions that people had and clarify items. And for those of you who would like to support this effort, we'll also give you a template on what you might be able to send in a letter or an email to your elected official. And that will, again, help you. We want you to have the tools to make informed decisions. We know we might not always agree on everything, but these types of programs are great opportunities for us to come together and have great discussions, answer questions, share stories. So hopefully we can do another one of these again down the road, but I appreciate you all taking time out of your schedule to join us tonight, and just wish you all a good evening. And thanks again to all of our speakers. Appreciate your support. Have a good night, everybody.